Hello, everyone, and welcome to today's presentation. I'm glad you're here. Today, we're going to explore a topic that's increasingly relevant in our work lives: work stress and burnout. Our slide today is titled, Work Stress and Burnout, an Overview. We'll look at what burnout really is, how it differs from everyday stress, and why it's important to understand its impact on our health. So, let's get started and dive into what this means for all of us in the workplace. As we look at the prevalence of burnout in the U.S. workforce, it's clear that this is a significant issue affecting many employees. In fact, nearly half of workers report feeling burned out at some point, which highlights how widespread this problem really is. And it's not just a vague feeling. Many people experience emotional drainage on a daily basis, which can really take a toll on their overall well-being. Work-related stress is also extremely common, with about 77% of employees experiencing it in the past month. That's a huge majority, and it shows how pervasive stress has become in today's work environment. This level of stress doesn't just impact individual health, it also has serious economic consequences, including absenteeism. To put that into perspective, around 1 million Americans miss work each day because of stress. All of these points connect back to a broader theme: how stress and burnout are not only personal challenges, but also organizational and societal issues. Addressing this problem is crucial if we want healthier workplaces and a more sustainable workforce. Now, let's take a closer look at the symptoms and causes of burnout. Burnout shows itself in a variety of ways, and understanding these signs is crucial for recognizing it early. You might notice persistent fatigue, feeling exhausted no matter how much rest you get, or a sense of detachment, where you feel cynical or disconnected from your work. Increased irritability and a drop in motivation are also common, and unfortunately, physical complaints like headaches or stomach issues often accompany these emotional signs. On the causes side, burnout typically stems from workplace conditions. For example, an overwhelming workload or long hours can quickly drain your energy. When you feel like you lack control over your tasks or your role is ambiguous, it adds to the stress. Toxic environments or unsupportive colleagues can make things worse, creating a sense of moral injury, where your values are compromised, or microaggressions that chip away at your well-being. By understanding these symptoms and causes, we can better identify burnout early and work toward creating healthier work environments. Recognizing these patterns is a key step in breaking the cycle and promoting overall well-being. Now, let's explore the broader impacts of burnout on both health and organizations. When someone experiences burnout, it's not just a matter of feeling tired or stressed. It can lead to serious health issues. For individuals, the risks include depression, anxiety, trouble sleeping, and even physical conditions like heart disease and diabetes. These health problems can be long-lasting and quite severe. On the organizational side, burnout doesn't just affect the individual, it impacts the entire workplace. We see drops in productivity, meaning work gets done more slowly or less effectively. Errors tend to increase, which can compromise quality and safety. Additionally, burnout stifles innovation because employees are less motivated and less willing to take risks. All of this also leads to higher turnover, which then creates additional costs and disruptions. And it's important to understand that the toll isn't just personal or organizational, it's also economic. In the United States alone, work-related stress contributes to thousands of deaths each year and racks up healthcare costs around $190 billion annually. So, burnout isn't just a personal issue, it's a significant societal challenge that demands our attention and action. This connects directly to our overall theme of promoting healthier, more sustainable work environments for everyone. Now, let's take a closer look at some of the key risk factors and groups that are most vulnerable to burnout. First, heavy workloads and working long hours are major contributors. When you're constantly pushed to your limits without enough downtime, it's no surprise that stress levels skyrocket. Poor work-life balance only makes this worse, making it difficult to recharge and maintain overall well-being. Another important point is the lack of support and recognition from management or colleagues. Feeling undervalued or ignored can really chip away at motivation and morale. coupled with low job control, where employees have little say over their tasks or schedules. These factors can significantly increase burnout risk. Now, when we look at who's most affected, younger workers tend to be more vulnerable, possibly because they're still establishing themselves professionally or may feel more pressure to succeed. Similarly, those in helping professions, like healthcare workers, are often on the front lines, facing high emotional demands daily. All these factors are interconnected and help explain why certain groups might be more prone to burnout. Recognizing these vulnerabilities is essential as we develop strategies to support our teams and foster healthier, more sustainable work environments. Now, while we've seen a rise in burnout among employees, it's important to recognize that significant gaps still remain in workplace mental health support. For example, many employees don't have adequate insurance coverage for mental health services, which can be a real barrier to getting the help they need. Additionally, there's often a lack of a supportive environment for taking breaks or time off, something that's crucial for recovery and maintaining well-being. Another key issue is the stigma around mental health. Many employees fear disclosing their struggles because they worry about judgment or negative consequences. And surprisingly, employers sometimes overestimate how good their mental health provisions actually are. They might believe they're doing enough, but the reality for many employees is quite different. All of these gaps highlight how much work is still needed to create truly supportive workplaces, especially as we continue to focus on overall mental health and well-being. Now, let's talk about strategies for preventing and recovering from burnout. It's important to recognize that this isn't just about individual effort. Systemic changes in the workplace play a critical role too. Addressing core work conditions, like workload and fairness, helps create a healthier environment overall. Equally important is fostering psychological safety, where employees feel comfortable discussing mental health issues without fear of stigma or judgment. Encouraging open dialogue is key to building that trust. On a practical level, promoting regular breaks and respecting personal boundaries are simple yet effective steps. Providing accessible mental health resources ensures employees know where to turn when they need support. From an individual perspective, supporting mindfulness practices, encouraging regular exercise, and facilitating access to professional help can make a real difference. Overall, combining workplace adjustments with individual coping strategies creates a comprehensive approach. This not only helps prevent burnout, but also promotes a culture of well-being and resilience, which is essential for a healthy, productive organization. As we come to the final slide, I want to emphasize that tackling burnout is essential for creating healthier, more productive workplaces. Burnout is a widespread problem that doesn't just affect individual health. It also has serious economic consequences for organizations. So, addressing it requires a dual approach. First, we need systemic changes within organizations, things like workload management, fostering a supportive culture, and promoting work-life balance. But equally important is supporting individuals directly, helping employees build resilience and manage stress effectively. Prioritizing mental health is a win-win. When we focus on well-being, we don't just improve lives, we also see a boost in productivity and engagement. And there are innovative solutions out there, like immersive mindfulness tools. For example, CogniHab's virtual reality-based stress relief helps teams reset and manage pressure more effectively. Ultimately, creating a healthier work environment isn't just about policies. It's about culture, support, and embracing new technologies that promote well-being. Together, these steps can lead to workplaces where everyone can thrive. Thank you so much for taking the time to be here today. I truly appreciate your attention and engagement throughout this presentation. If you're interested in learning more or staying connected, please visit us at www.cognihab.com. That's where you'll find additional resources, updates, and ways to get involved. Remember, the key takeaway is that understanding and applying these concepts can really make a difference in our field and in the lives of those we serve. So I encourage you to explore our site and continue the conversation. Thanks again for your interest and your commitment to this important work.